Lifestyle changes, simple lifestyle changes can also help prevent recurrent UTIs, such as drinking plenty of water, practicing good hygiene, urinating frequently, emptying blood after sex, avoiding irritants, and wearing cotton underwear. Yo guys, welcome to our video. Welcome to our channel. The channel is Future Talks. Welcome to our video. Today we want to talk about something very important also regarding our health. Uh, Kindly, if you have not watched our previous video, I've shared a lot of videos on medications, on how to take medication and the various functions of medication. Talked about various conditions, and today I want to talk about something very important, which is also very common with us. I want to talk about what we call recurrent UTI. Recurrent UTI means, by UTI it means urinary tract infection, urinary tract infection, and sometimes urinary tract infections are confused with sexually transmitted infection or STI, but there is a very big difference because the UTIs affect the urinary system and also the STI affect the our sexual organs in various ways. So there's that difference. Sometimes when a patient comes to you and you tell that patient you have a UTI, they always confuse it with STI and they want to blame their partner for getting that infection to them. Urinary tract infection, or recurrent, I want to talk about recurrent urinary tract infection. From the recurrent, it means that you get these infections once, one uh, more oftenly, and it's very common, particularly in women. And I'm going to share the reasons why the UTIs or the urinary tract infections are more common in women than in men. And this recurrent UTI, recurrent means once, and it means it clears and comes back. It clears and comes back, so it's called recurrent. So we are going to see why it becomes what it's called recurrent urinary tract infection. So they occur when a bacteria, usually from the digestive system, enter the urethra and they infect the urinary tract infection, urinary tract. That's where the urine passes in our system. Sometimes these urinary tract infections can go up to the bladder. Bladder is where the urine is stored, and they even affect the kidneys at some point. But we will share it at a certain point. But today I want to focus on urinary tract infections. But most of the time, this UTI can be easily be treated by antibiotics, and it clears off very very well. Uh, so when you have those problems with the urinary tract infection, you can come to the doctor. The doctor can prescribe, you do maybe a urinalysis, very common in Africa where you do a urinalysis, and they can see how your urine is doing. And at some point also the ultrasound is done to check on your pelvic organs, including your bladder, and also find on how one is doing. So uh, there are sometimes this UTI can be very complicated and very frustrating. People are put on medications and they don't respond to medications properly, and sometimes it may lead to a lot of problems to them. So there are some factors that can cause or contribute to the recurrent UTI. The one of them is what you call is anatomical factors, because some people may have naturally shorter urethra or other anatomical factors that may be may put them into predispose them into getting this more to get the current UTIs. So anatomical factors, especially especially those people with shorter urethra. So because now the infection can easily move there, so you get there's a problem there. Another, the second thing is bacterial resistance because of the overuse or inappropriate use of antibiotics, which can lead to bacterial resistance, which can make UTIs more difficult to treat and more likely to recur. So that is why it's very important to always get a prescription from your doctor, because misuse of drugs, especially antibiotics, now when you have that problem, you can't be treated with the drugs, so it really becomes tricky for you to get well uh, for for treatment. So you develop what you call drug resistance, so you can't get well, you will always have those UTIs. Another uh, possible cause for the UTI is sexual activity. Sexual activity can increase the risk of UTI, especially in women. The use of especially the spermicidal agents and certain types of contraceptive can also increase the risk of having those UTIs. Spermicidal are they are drugs which are put in the, especially in the vagina, to kill the sperm so that one doesn't get pregnant. So such kind of thing also can bring an issue with the recurrent UTI. Another factor which may be contributing to recurrent UTI is menopause. Menopause is when now, because of the hormonal changes in the body, especially in the ladies, menopause affects the ladies most of the time with the age. Now, with menopause, there is the hormonal changes in the body. So, because hormones also protect the lady's body from other conditions, so you get that now because of the hormonal changes, you are at a greater risk of getting those recurrent UTI. Another main cause of recurrent UTI is diabetes. This is now where the body cannot regulate insulin well in the body, because people with diabetes have a high risk of UTI due to the changes in the especially in the immune system, and also in the urinary tract function, because diabetes affects the way the kidney works, and also the way the immune system works. So you get that the immunity is compromised a lot at that level, so the patient is likely to get the recurrent UTI. So another factor which can bring about this issue of recurrent UTI is the immune system disorders. People with weakened immune systems, such as with HIV, are very susceptible, or they are likely to develop these UTI. So immune system disorders such as HIV predisposes one to those kind of challenges. So how can you prevent recurrent UTI? Number one, drink a lot of water. Staying hydrated can help flush bacteria out of the urinary tract. So those 6 to 8 glasses we are told to take each day, and most of the people don't practice that. It's very important that you take that water, 6 to 8 glasses, because it also helps to flush bacteria out of the urinary tract. Another thing, practice good hygiene. Especially ladies are taught on how to wipe their private parts. Wiping from front to the back after using a toilet can help prevent the spread of the bacteria from the anus to the urethra. As well, somewhere I mentioned, when that bacteria from the anus gets into the urethra, so we get into a lot of problems. Another thing, urinate frequently. Urinating frequently can help flush out of the urinary tract. So when you get that urge to urinate, please urinate. It flushes out those bacteria. Another thing, empty your bladder after sex. Urinating after sexual activity can help flush bacteria out of the urinary tract. So that's self-explanatory that after sex, urinate to flush out the bacteria out of the urinary tract. Another factor, which is very important also, is that you get to avoid irritants. Certain products such as bubble baths, powders, douches can irritate the urethra and increase the risk of UTI. So avoid strong things in your private part, because that now predisposes you to recurrent UTI. Uh, another thing which is recommended to prevent this current UTI is the take of probiotics, because some studies that suggest that taking probiotics may help prevent recurrent UTI. So probiotics are also special class of drugs which your doctor will share with you, so that they get to help maintain the normal functioning or the normal flora of your private part, especially the vagina, so that you don't get exposed to recurrent UTI. If you experience recurrent UTI, it is important to talk with your healthcare provider. They can help you identify any underlying causes and offer appropriate treatments. Options such as antibiotics, long-term or low-dose antibiotics, or other medications. In some cases, surgery may be necessary to correct the anatomical issues, especially if you have a problem with your urethra. There's a special way the doctors maneuver that to get you into a proper way of functioning of that. So how do you treat the these recurrent UTI? Antibiotics I've mentioned, very important. They are typically the first line treatment for the UTI. The type of antibiotic prescribed will depend on the specific bacteria causing the infection. And most of the time you get that the doctor will go for a culture and find out what is causing the infection, so that they know the drug which is likely to treat the patient. So it is important to take full course of antibiotics as directed by the doctor, so that you don't develop resistance, and you will be given a lot of drugs, and also very strong drugs, which also may be not very comfortable for you, and at some point they are not economical to you, and also may lead to other problems. So proper take of antibiotics is one of the way of managing this UTI, recurrent UTI. So in some cases, because of the recurrent UTI, a patient is put in a long-term kind of low-dose antibiotics to always treat these recurrent UTI. Use of probiotics I've mentioned, which are beneficial to bacteria, may help to prevent the UTI. In some in probiotics, even there are some, especially there's a special bio yogurt, especially is used as a probiotic, so that it gets to maintain, to introduce that bacteria to your urinary system, so that you get well. Probiotics are not douches. They are not inserted through to your private parts. There are people who teach people you to insert some other things into their vagina. At the end of the day, it gets people into a lot of infections, and you will find that you get into a lot of problems with such kind of things. Another way of managing recurrent UTI is what we call hormonotherapy, or hormonal replacement therapy, which women experiencing recurrent UTI, which is due to menopause related hormonal changes, may benefit from hormonal replacement. And this is specifically done by your doctor, who gets you the proper hormones which you need. And also there's now the problem of recurrent UTI is solved. Another way of doing away with the recurrent UTI is surgery, where surgical procedures, in some cases surgical procedures may be necessary to correct underlying anatomical issues that can cause the UTI. Another way of preventing is through lifestyle changes. Simple lifestyle changes can help you prevent UTI, and that is what I most recommend through the lifestyle change, especially such as drinking plenty of water, practicing good hygiene, urinating frequently, emptying your bladder after sex, avoiding irritants, and wearing cotton underwear. In my previous video on the smelly vagina, I talked about wearing cotton underwear to make your pussy or your vagina breathe well. It also prevents having that awkward smell, and also avoiding getting a lot of infection in there, including the UTI. So lifestyle changes is very important. I know sometimes we run in a very busy society where we sometimes forget ourselves, especially for us healthcare providers. We focus on taking care of the patient, we forget ourselves. We even forget about emptying in that our bladder at some point and taking that water which we carried to maybe to our workplace. But remember to have that sip of water, and also to empty your bladder. It also protects you from the diseases, because also those patients need you in the next day, and also you need your health to take care of those people. So don't, guys, especially those who are healthcare providers, don't forget ourselves. Or those people are very busy in their offices, don't forget about yourselves and work for the institution and also work for that office. Also, our health is very, very important. So remember to take a lot of water, and also remember that so that you get hydrated very well, and also that you get to go to the toilet and empty your bladder as frequently as possible, so that we get to flush out that bacteria from our system. Um, we may have complications, or sometimes we have complications of recurrent UTI. Number one, we have kidney damage. If a UTI spreads to the kidneys, it may cause damage to the renal tissue and potentially lead to kidney failure. That's how serious this recurrent UTI is. Number two, sepsis. In severe cases, a UTI can lead to sepsis, a life-threatening condition that occurs when the body's response to an infection causes widespread inflammation and organic damage. Number three, chronic bladder infections by recurrent UTIs can damage the bladder lining, making it more susceptible to future infection and leading to bladder infections. Another complication we may have is urethral narrowing, or the narrowing of the urethra. That's where the urine passes on our system. So frequent UTIs cause scarring and narrowing of the urethra, making it difficult to urinate and increasing the risk of the UTI, and also getting other very bad infections. And also recurrent UTI can cause preterm birth, especially for women who are pregnant. This can cause pregnant women with recurrent UTIs. It is science-based and evidence-based that they may cause an increased risk of having that preterm birth. And with preterm birth, that means immature babies born, and also that's a source of an abortion, where now the kid can't survive because they are born before time. So guys, before we get into those kind of problems, let us have that culture change, and also especially do the basic on lifestyle changes. Simple lifestyle changes can also help prevent UTIs, such as drinking of water, practicing good hygiene, urinating frequently, emptying the bladder after sex, avoiding irritants, and wearing cotton underwear. Very important, guys. Very simple, but very important. Guys, welcome to our channel. The channel is Uter Talks. Kindly, if you have not subscribed, subscribe, like, and give a nice comment down below. That is the best way you can support us. Guys, welcome to our next video, and always keep in our channel. Thank you very much, and peace.